I'm not coming on board with the training manuals that we use in building capacity. Capacity of different category of people that are carrying out interventions in the area of GBV. For frontline health workers, we have different manuals of training them. You understand? That is gender-based violence training curriculum, we have them and all that. And we've conducted some of the trainings in the area of capacity in some states already, piloting them. For FGM, we'll be moving, I think in the next 2 weeks? Next 2 weeks. First week of September. We'll be moving on FGM because this one will be able to put it in training module so that frontline health workers will be taken across, and we are getting support from USAID Momentum. You understand? The aspect of it that I have to recall in gender health. They are the ones supporting us in that area. So that shows that we are actually collaborating and working together. Then let me address the next one. Provide more support to public and private health facilities on GBV response. For this, you understand, the support is ongoing. And the support does not just stop in the area of making sure we have what we call a GBV referral center, you understand, in most facilities, big facilities. But because sometimes the violence occur at the grassroots level, you understand? Yes. So we are focus is on sexual assault referral center, whereby the sexual assault referral center are closer to the community and are closer to the people where they reside. They are scattered everywhere, and we can give you a list of sexual assault reference centers that are registered with the Federal Ministry of Health that we know as that, and they are still counting because many others are also coming up as people are establishing more such interventions. So I don't know whether your coming in will be in the area of sexual assault reference center to create one in a place whereby all the contingent of a sexual response assurance center is there, a health care provider will be there, and then everything that will make it conducive for the people to be able to talk is there. So capacity will be built, and then providing them with all the training and this thing. If you are so interested in that area, so good, and it will be for the area of support. But let me also go on to tell you that we've moved beyond the sexual assault reference center to make sure in every state they have a network, a neat network, you understand, of a referral pathway, because sometimes you may see a case at the grassroots level and you are the healthcare provider that the person has come to confide in. How do you attend to that particular person? And the attention depends on individuals that have been violently abused. It could be a child, it could be a male, it could be a female, it could be an old person, it could be one of these disabled people. As a healthcare provider, how do you attend to them? And if you needed evidence, because most of the culprits of the perpetrators of GBV actually go scot-free because there is no hard evidence documented, especially medical evidence. So we also go to the extent of training them and making sure when you look through our training manuals, you will see criteria. What sample do you take when you have? At what time do you think of a forensic documentation? You understand? And the establishment of forensic centers across the six geopolitical zone. We already have at least, I think we have one in Sokoto, Adamawa, and others are still coming up. All is to make sure they battle this thing out, forensic for GBV survivors. So that when you refer them, once you get to the forensic, they can take forensic specimens and then they can analyze it in those labs where they have the capacity to analyze it. So all those things are on ground to make sure we run with it. And the health workers will build their capacity to see at what stage they can collect. When somebody has oral sex forcefully, when do you think, within how many hours do you think the specimen will still be available there? Or when the skin, or a woman is vaginally, maybe a woman was forced rape case, when do you think you can get the sample within how many days? Within less than 5 days, maximum 5 days, you should be able to get the sample. Otherwise, it might not be able to give you enough evidence for you to do. Anal sex, how do you do that? If the woman has washed, how do you still get the evidence? And how do you go about maybe which of the materials is there for forensic that we have, which is any material like clothes of the person, the evidence is ever there. You understand? So all those things we teach them on how they will come up and their web package on how we should go, so that the frontline health worker knows how to attend to a GBV patient. That is the area of your psychosocial support comes in. In the training, in order to make sure they know how to attend to these people, there's another thing that we refer to as list. You understand? And he had different criteria, but I'm not going to lecture today.
Right.
But I'll be glad to inform you that in it, they're trying to tell you that they should learn how to listen to somebody who has just been a survivor of GBV. Listening to them, because paying attention to them is when they come to complain to you, not to say, madam, you caused it, now why did you dress like that? Why did you know we rape you? All those kind of things. We teach our health workers on other people on how they can manage them. And when they leave and they go and meet the police, how the police should play their own role. What role should family members play in order to make sure they are on? And when they come to the health facility, how a doctor or a healthcare provider should be meticulous enough to make sure, apart from taking a proper history, you also do a proper examination and end it up with forensic sample taking, so that you'll be able to follow the proper channel of referral for the person to be able to get justice if he or she so wish. Because we don't coerce them from our own head angle. We don't coerce them to say you must report your husband or you must report the person that raped you. But we'll give you informed counsel so that you can make your own informed decision when it comes to the issue. But health-wise, we'll manage you so that you'll be alive and stable. And anytime you want to seek evidence, medical maybe judicial intervention, you come to us, because of proper documentation will give you evidence that will support you from the medical angle. So that one is addressed.